cervical evaluations, starting with ABCs, checking airway, breathing, and circulations, the past and present history, inspecting for any swelling, discoloration, or deformities, bony palpations, checking for fractures, subluxations, starting with the spinous process here, our cervical spine area, palpating all the way down, transverse process, which is bilateral here to the spinous process, occiput, which is going to be posterior base of the skull. Right, soft tissue palpations, trapezius, checking for any strains, contractures, paravertebrae here, which are the extensor muscles, extending muscles of the neck. Alright, make this face. Alright, scalenes here are going to be the sheet muscles on either side of the trachea, and the sternocleidomastoids are the larger muscles here. I'll also be looking at cartilage and lymph nodes on either side, checking for enlargement. That looks good. Next we'll be moving on to special tests. Brachial plexus traction test, so you can stay seated. I'm going to compress on the head, do a lateral bend to the left, and a lateral bend to the right. Checking for tension and compression of the bilateral plexus. Positive test would be numbness or nausea felt with that. Next will be shoulder abduction test. So lift that shoulder up, hand behind the head here. Perfect. Positive test would be any pain that's relieved from this motion, which could be a sign of disc herniation or nerve root composition. Bring it down. Next test is cervical compression. So again, I'll be trying to just push down on the head. Positive test would be pain, numbness, or nausea that they're feeling. Checking for facet irritation and stenosis. Sperling's test. Start by putting a side bend here. Flexion, rotation. Positive would be numbness or any sensations like that. Cervical distraction test, which is opposite of compression, so a decompression. Put one hand here under the occiput, one on the chin, distract, pulling upward, checking for facet irritation and stenosis. A positive test would be any pain that's relieved from that decompression movement. Vertebral artery test. Can you scoot back? Scoot a little bit so your butt's hanging off the edge. And then you can lie back. Wait, flip over for me. Sorry, head facing me. Checking for occlusions. We do flexion, extension, rotation. Positive test would be numbness or pain. Perfect. You can sit up for me. I need your foot here, lie back. Babinski test, I'll be scratching from the heel up here, looking for upper motor lesion. A positive test would be extension of the big toe and abduction of the smaller toes. Oppenheim's test, I'll be putting my fingernail and scratching up the medial fin, checking for upper motor lesions. Same positive test, extension of the big toe, abduction of the smaller toes. Valsalva maneuver, put your thumb in your mouth, Close your lips around and blow without releasing air. A positive test would be pain, numbness, or nausea for disc herniation. All right, range of motion, you can sit up for me. All right, just do as I do here. Flexion, so bringing the chin down. Extension, chin up. Rotation to the left, rotation to the right. Lateral bend to the left, and lateral to the right. Okay, resisted range of motion. I'll be placing a base hand on the shoulder here, providing some resistance as you move range of motion. So we'll do those again. I'm gonna put my hand on your forehead and try to pull your chin down this way. Sorry, cold hands. So push, push, push. One more time. Testing the sternocleidomastoid and the anterior scalenes. Extension next. So I'll put my hand here opposite. There you go. Up. One more time. Testing cervical paraspinals, trapezius, and the levator scapulae. All right, rotation here. So try to look to the right here. Look, look, look. And here. Testing contralateral sternocleidomastoid and trapezius. And then lateral bending. So bend against my hand. Good. Good. Testing ipsilateral scalene, sternocleidomastoid, and paraspinals. Okay, next would be neurological. First motor, C5 is deltoid, so abduction. Perfect. C6, bicep flexion, so bicep curl. C7, tricep, so arm extension here. And C8 is finger flexor, so curling the fingers in. All right, sensories, C5 is the deltoid, C6 is the thumb, C7, middle finger, C8 is the pinky, T1, medial elbow. Perfect. Reflex test. C5 is bicep, so normally we go with a bicep chop, looking for any motion. C6, brachioradialis. I'm gonna do a forearm chop here, so this one hurts. And C7, triceps. Arm back here, dangle, and chopping on the triceps. Perfect. And then I would do radial pulse here on the hand, carotid pulse up here on the neck, and then finishing by taking the patient's blood pressure.